All right, we're going to go ahead and start. Hi, good afternoon, everyone. Thank you again for the privilege of your time and attending another Penny Community Work Group session. We are very excited to have you here with us today as we have a lot of good updates to share, as well as some materials that we think that you'll find very interesting. We are utilizing an MS Teams Live format with this meeting, so please know that your microphones are muted. However, you can always submit questions in the chat, and more on that here in a second. But to briefly go over today's agenda, of course, we have some updates for our community partners here at Penny. We are going to be joined by Penny's External Affairs Director, Chachi Angelo. He's going to provide us with some insights on the unwinding of the public health emergency and on the American Rescue Plan subsidies. Hannah Turner is joining us today to cover some new system updates that are coming down the pike, as well as giving us a deep dive into understanding advanced premium tax credit calculations and mid-year changes. And as always, we'll have time for questions and feedback during the meeting. We will have Penny staff members available to answer questions as they come through the chat. So please, again, don't hesitate to ask questions as we go. And with that, I did want to point out something that's very important about these sessions. Penny's Community Work Group has a dedicated page. If you go to our agency website, agency.penny.com, right across the very top, you'll see where it says Work Group. If you click on Work Group, number one, this resource page will not only inform you about upcoming meetings and provide you with the link to that community work group meeting, but also ahead of time, we post the public agenda. We do record these meetings, and these meetings are available as a resource after we meet, as well as the meeting deck and the materials that we cover. And again, to your questions, when you ask questions in the chat, we're able to record those questions and have our teammates here at Penny address those questions for you. So again, please know that we encourage questions and your feedback. An important update to share, and you can access this again through agency.penny.com/toolkit. We've been working on some materials specifically for small business owners and their employees who may not find themselves in a position where they have access to group coverages. And we've developed a new fact sheet that can help small businesses better assess whether or not they and their employees would have options through Penny for health and dental insurance. Another flyer that we recently created was specifically for hospitals, health centers, clinics, urgent care facilities that would like to provide their customers in the waiting rooms with a piece about Penny. And again, these are all available. These materials are all available through our toolkit at Penny. You can order them free of charge, and we can send them directly to you as a resource for you and those you serve. Another very important thing to mention is that Penny has been working very hard on developing an English and Spanish glossary of terms. Many of us know that the terms, the acronyms, etc., that are used and associated with health insurance, dental insurance, they can be pretty overwhelming, especially when you consider approaching them in a secondary language as opposed to your primary language. So as a starting point, we've created a glossary of terms in English and Spanish to help those in the communities who would find it beneficial to learn more about those. Again, this will also be available through penny.com, and we'll have that glossary out there for use in your community. Another update that is very near and dear to our hearts here at Penny is through 2021 and 2022, we've seen significant impacts in the quality of life for a number of individuals across the Commonwealth of Pennsylvania who, for many of them, for the first time, have been able to not only access quality health insurance, but health insurance from the vantage point of being able to afford that health insurance. Currently, Penny is gathering customer testimonials. These testimonials do not have to be exacting. We will, believe me, love to hear any anecdotal feedback that we would receive regarding how the American Rescue Plan and how the enhanced financial assistance through the American Rescue Plan has helped individuals, families, small business owners in your community. Believe me when I say we would love to hear that type of feedback. If you're submitting testimonials, you can actually do that by way of Penny's community partner website. Through the community partner website, penny.com/community-partners. Through that site, you can go to the bottom and submit your anecdotal customer testimonials in the section where it says "Let's talk more" at the bottom. Simply check on the form that you'd like to share an idea with Penny. In this case, you're actually sharing a customer experience, an individual experience, a family experience, where not only Penny, but the enhanced financial assistance through that American Rescue Plan has really made a significant difference. An example is provided here for you. And again, the deck will be available to you so that you can look back at this and the other resources we're sharing today. But the example that we have is, in Pennsylvania, Jill, a mom with 2 children living in Johnstown, could not afford to purchase coverage. Through the American Rescue Plan funding, Jill was able to enroll in a plan with $0 premium. When you submit this type of information, all that we ask for is the first name, the city, town in Pennsylvania where they live, a little bit of information about their household. If you know that, in this case, in the example, Jill has 2 children as well, and how much they saved through the American Rescue Plan, if you know that. Again, you can find this comment form at the very bottom under "Let's Talk More" on our community partners webpage through Penny. So again, thank you so much for not only the service that you provide in our communities, but for helping so many get protected. At the end of the day, that's what matters most. I also wanted to mention that Penny recently had an advisory council meeting, and just like our board meeting at Penny's agency site, again, agency.penny.com, you'll see a section where you can access not only the meeting link and the agenda, but also the meeting deck that has all of the updates that we here at Penny provided our advisory council. So I wanted to make sure that you were aware of that resource as well. Right now, we'd like to shift gears a little bit and invite Chachi Angelo, our Director of External Affairs, in to update us on not only the unwinding of the public health emergency, but some of the strategies that we're working on here at Penny to help individuals and families who may find themselves in need of other healthcare options and health insurance options. Chachi, please take it away.
Sure, Scott. Good morning, everybody. It's good to speak with some of you again. Hope that you guys are enjoying your Friday so far. I think on these first couple slides, I think it might be best if Hannah Turner takes these two, and then I'll jump in and give more color and background to some of our communication and marketing efforts. Hannah, are you okay with that?
Yeah, no problem, Chachi. Happy to do that. So we talked last month about the public health emergency unwinding. Figure it'd be helpful to just do a quick recap for those who maybe didn't attend the work group last month or just need a refresher. So the public health emergency was put into effect in March of 2020. It did lots of different things, but where we're primarily focused is on the aspect of the public health emergency that prevents people from being disenrolled from Medicaid or medical assistance. So since March of 2020, if someone became eligible for Medicaid or medical assistance, the public health emergency prohibits them from being disenrolled. So obviously there's been a lot of increases in Medicaid enrollment, not just in Pennsylvania, across the country. So what we're preparing for is what will happen when the public health emergency expires and we have to sort of unwind these provisions, in particular, like I said, the focus on Medicaid enrollments. So what's going to happen when public health emergency expires? We usually refer to that as the PHE unwinding process. The Department of Human Services here in Pennsylvania is going to take about 6 months to redetermine eligibility for all the individuals enrolled in medical assistance because of the public health emergency. The latest estimates, which actually were, I'm not sure if these have been updated yet, but are about 950,000 individuals might be found ineligible for medical assistance. So that's a lot of people. Some of those who are no longer eligible for Medicaid are going to need to find coverage elsewhere, including Penny as a likely source of coverage for a lot of these folks. So what's new since we talked last time, which was last month? One thing is that the public health emergency has officially been extended. When we talked last month, it was still projected to expire on July 15th. It has now been extended until October 15th of this year. It remains possible for additional extensions. They've been doing sort of these 90-day extensions for a good while. So, but now we're looking at a 10/15 expiration date. And we talked a little bit last time about a variety of things that we are working on to try to make this process pretty unprecedented process as smooth as possible. And so looking through various technical, operational, communication, and policy options to help make the transition for these individuals as smooth as possible. So in particular, I wanted to call out that we do have a board meeting today, right after this meeting. It's at noon, which is going to consider a policy proposal that would allow customers who lose coverage during the PHE unwinding period to be able to choose an earlier coverage start date. They would default to the normal coverage start dates, which is the first of the month following your planned shopping. But this policy proposal that they're going to consider today would allow just during this PHE unwinding period, the ability to choose an earlier start date. So as I think Scott mentioned earlier, board meetings are open to the public. We've got a link there. It's on the agency site. If you are interested, wanted to call out that we are having that meeting there. And we'll, of course, keep you updated as developments occur with regards to any policy decisions or any changes to the expiration or and then as we get closer to actually implementing this, we're going to spend a lot more time talking to you about the nitty-gritty of the operations of what this is really going to look like throughout this process. So go ahead and go to the next slide. And so here's a high-level timeline of the new, based on the new public health emergency end date of 10/15/2022. we would see the public health emergency end there on October 15th. Right after that, November 1st, open enrollment begins through Penny. And starting in November, December, we're going to start seeing some account transfers over from Medicaid for people who are found ineligible. And that's really going to continue on a cycle all the way through, into April of 2023. So there is an overlap initially with our open enrollment period, but obviously anybody who's losing Medicaid is eligible for a special enrollment period under loss of MEC. And then, we could see some of these folks, depending on when they lose their Medicaid, potentially having a special enrollment period up as late as around August of 2023. The Penny Board in May did decide to, for people who lose coverage during the PHE unwinding period, that they would be eligible for a 120-day SEP period instead of the normal 60-day SEP period. And so that's why you're seeing the SEP enrollments going out as late as into August here on this timeline. So again, a lot of still open items, but this gives you a broad sense of what this will look like under the new timeline of a 10/15 PHE expiration date. And so, Chachi, I will hand it over to you to talk about the marketing communications.
Thanks, Hannah, and thank you for taking those 2 slides. Before I jump into the communication and marketing efforts about the public health emergency, I wanted to thank Scott for bringing up the need for testimonials or at least anecdotal stories about customers that you're assisting, about how much they're saving from the American Rescue Plan. As you know, there hasn't been any movement from Congress to extend those enhanced subsidies. So we're really using those stories as a way to tell the story about how the American Rescue Plan subsidies are really helping people, especially with rising costs all over the country. So just wanted to stress, you can help us tell that story to our representatives to keep these subsidies in place. So going over to the public health emergency unwinding, us on the external affairs side, specifically marketing and outreach, we are tasked with the job of trying to make this all make sense and communicating to both stakeholders and customers, and really up against the very real possibility that a majority of these identified populations might not know who Penny is, because Penny has really been stood up during the pandemic, and there hasn't been redeterminations, they really have a task of doing more of a reintroduction, a Penny brand launch 2.0 for a significant portion of Pennsylvanians. So we, in communications, you really are worried about, you're really focused on your target markets and the impacted populations here. One being those that are receiving medical assistance now are deemed ineligible. They respond to the packet and they're transferred over to Penny. The second population is those that do not respond to their renewal packet and are procedurally terminated. We have received approval from DHS to contact this population prior to the conclusion of their reconsideration period. So the messaging is really going to be to that second population to respond to their renewal packet, so they really don't have to start from scratch. And so going through our high-level timeline here, early October we start our with the PHE, assuming that it ends October 15th. Early October, mid-October is when our advertising campaign will begin. Open enrollment's on the way, and this is who Penny is, and this is who we serve and how we serve. with mid-October is whenever it officially ends, and then the outreach to those transferred populations begin, and also advertising that open enrollment's on the way. Open enrollment starts, our open enrollment campaign begins, and the PHE will continue. So really during open enrollment is a bit of a messaging challenge, because we're saying now's the time to enroll for 2023 coverage. However, if you've lost 2022 coverage, come on over, you can still get coverage for the end of the year. And I think that our creative vendors, our media buy vendors are really trying to get a better focus on a way of delivering those messages, especially from an advertising perspective. At the end of open enrollment, our advertising for open enrollment will end, and then our lighter, more focused PHE advertising campaign will go all the way to the end of April. And with that extended SEP, our last bit of outreach efforts will come to conclusion August 2023. It's wild to be at June 17th, and we're talking about next August for timelines, but that is the work that we do. Scott, if you want to jump to the next slide, I'll go into a little bit more about the tactics that we're going to use for communication and marketing efforts. We've been working with DHS to create a PHE-focused stakeholder toolkit. So you're going to be able to share information, have information, talking points, collateral, even digital collateral that you'll be able to use to better communicate the unwinding to your customers or those that you assist. So consistently reaching out to all Penny, the full Penny community. Our owned media is making sure that our mailers, our notices, our emails, our outbound calling campaigns are consistent throughout, and making sure that our website and social pages are updated accordingly. Earned media is going to be a joint effort with DHS to make sure that we're getting out in the press in due time to not cause panic of when we know when the PHE is going to end, and what the impacted audiences can expect to do. So that will be a joint press effort with DHS and Penny. Paid media is what I just went through. It'll definitely be a healthy mix of traditional, digital, out-of-home, lifestyle, outreach, sponsorships, and events. Our healthcare provider outreach has taken major strides, I would say, in the past year of making sure that each outreach provider, depending on where people are getting their care, those helpers, those doctors, those admins know who Penny is, and able to at least push people along to penny.com if they're without coverage. And then fully prepared to have our health equity tour continue and expand with the YMCA. So we can jump into updates on the American Rescue Plan and the subsidies, as I mentioned earlier. So Congress hasn't acted yet to extend those subsidies past 2022. So from our marketing communication side, we've always been hedging our language on these subsidies are because of the American Rescue Plan, and if they go away, we intend to hedge that again of, due to the American Rescue Plan expiring. So if no action is taken, those subsidies are set to expire. There is still time for Congress to act on passing a bill to extend the subsidies, and Penny, along with a lot of other state exchanges, have continued to advocate for the extension of these subsidies, and asking Congress, to do so so that we can, mitigate the operational challenges that will come with reversing course. So the expiration of the ARP subsidies definitely will have a grave impact. I think that we're all on this call aware of what we could be looking at for the uninsured rate. A report that was published back in May by the Robert Wood Johnson Foundation says that PA could experience approximately a 12% decline in marketplace enrollments and an increase to the uninsured approximately 7%, an increase, I'm sorry, to the uninsured by 7% from 2022 to 2023 if the enhanced tax credits expire. So, while we're still continuing to advocate for an extension, we do need to prepare for the possibility of these ARP subsidies expiring, and kind of goes back to how I opened up my discussion, which is, asking you, part of the penny community, to share those stories, because I think if we're able to give the real human impact of these subsidies going away, it may move the needle a little bit on these subsidies being extended. And I think that's my time. Thank you.
Thanks, Chachi. It's Hannah again. So I'm going to talk a little bit about some upcoming system enhancements that we have coming at the end of the month. Go ahead, next slide. So the first one is actually a fix for something we talked about way back in February of this year. So what we had been seeing, or what you had been seeing as well, right, was sometimes when an application would come over from Medicaid, there were certain types of income that would be no longer included on that application. So the most common scenario where you were seeing this was when a customer would come to Penny, fill out their application, and be found potentially Medicaid eligible. So we would send their application to Medicaid for a determination. In that case, Medicaid reviewed it and determined that they were not eligible for Medicaid, and would respond back with respond back to Penny with, confirmation that, yep, they're not eligible for Medicaid. Go ahead and determine their eligibility for, financial assistance through Penny. What we were seeing then was the application we were getting back from Medicaid after they had determined the person not eligible for Medicaid. Certain types of income that were previously on the application were now no longer on the application. It wasn't all types of income. We were seeing it with certain, like, Social Security income, self-employment income, a few types. But that issue is being fixed, and it should be fixed by the end of this month. It's actually being fixed some point during this month, but by the end of this month, we shouldn't be seeing that any longer, which is great news. So if you had seen that previously, you should very shortly no longer be seeing that issue. Really appreciate the hard work of the folks over at DHS to help analyze and address and fix that pretty quickly for them. So the good other part of that means that because we have that fixed, we're actually now going to be able to turn on automated eligibility for Medicaid account transfer applications. That's going to start on July 1st. So this scenario is actually for when an application originates with Medicaid or CHIP and is then found ineligible for the Medicaid or CHIP and gets sent to Penny. So the previous scenario, we were talking about someone starting with Penny, getting sent to Medicaid, but then being found ineligible and coming back to Penny. Here, we're talking about people who start with Medicaid or CHIP and then come to Penny because they're not eligible for Medicaid or CHIP. So currently, when that scenario happens, we get the application from Medicaid or CHIP. We go ahead and create basically a draft application for the customer and notify the customer what steps they need to do to take action. And that action looks like the customer coming and logging into their account through Penny, and they actually have to click through that application. We have pre-populated it with the information we receive from Medicaid and CHIP, but they do need to navigate through it, review all of that, and then when they get to the end, they can then submit it and get their eligibility determination. And then once they have their eligibility determination, then of course the usual report a life event if it's not an open enrollment, and shop for a plan. What we're going to be doing with this automated eligibility means we're going to take a pretty big step out of this process for customers. So again, we're going to get the application from Medicaid and CHIP, but instead of just creating a sort of draft application that the customer has to navigate all the way through and review, we actually follow all the information and we'll be submitting that application. So their initial notice from Penny is going to include their eligibility determination. And then all they have to do is come in and report a life event and shop. So they don't have to navigate that whole process of clicking through their application, reviewing every single page, and only to get an eligibility determination. So that's going to take a lot of steps out of the process, and we think we'll hopefully, by giving people their eligibility determination upfront, will be help to get people to take action and actually get enrolled. The other component to this that's going to be really helpful is this will be a really important feature to help the seamless transition for people losing Medicaid during the public health emergency. This will really make the process a lot easier for them and more streamlined. So really excited to be turning that on. So you all should start seeing that, like I said, on July 1st. There's some other things that have come in the release that we're doing at the end of the month, but we'll be sending out release notes at the end. Those are the two really big things we wanted to highlight today. Okay, so for the next little bit, we're going to talk a little bit about APTC calculations and mid-year changes to those things. Go ahead and go to the next slide, Scott, for me. So going to do a basic recap here of APTC, PTC, and kind of the basics of how things work. So hang tight with me because I think this will be helpful to you by the time we get through the end here. So your premium tax credit, PTC, that's what someone claims at the end of the year on their tax return. And it is based on what their actual annual household income was for the year. What Penny does, though, is allows you to get, use an estimate of your annual income and household size to get access to that premium tax credit in advance, hence APTC, and so that you can reduce your premiums each month. And then at the end of the year, you have to reconcile that when you file your federal tax return. So if you, when you calculate how much PTC you're eligible for, if you reduce that by how much APTC you received during the year. So if you receive too much APTC, you could owe money back at the end of the year. That's the big problem. That's why we all focus so much on, working on getting a really accurate estimates of someone's annual household income for the year, because that's going to get them a more accurate APTC calculation and reduce the likelihood of, a risk of having to repay anything on their taxes. But it does highlight the risk, right? We are doing an estimate of income. And it also means that's why it's really important that customers update their income throughout the year if things change. And if you have any questions about kind of income and what income to include, we've got some good FAQs down here on the bottom, as well as if you look at last, I think in May, community work group meeting, we did spend a lot of time talking about income and income DMIs, and that'll also cover a lot of kind of what gets included in income. So in general, as your income increases, your APTC decreases. So you have a set amount of premium, and if your income is low, you only have to pay a certain, I'm calling that your net premium, right? That's how much the customer should pay towards that premium. And the APTC comes in and fills in the rest. So my two very simple examples, the same box, the box being here's the amount of premium you owe. And if you have lower income, then you only pay a smaller amount, that blue portion of that premium, and you get more APTC because you still have to pay the full premium, but you're only paying a smaller portion of it. If you have higher income, you're going to be paying a higher portion of the premium. That's your bigger box of net premium, and so therefore you have smaller APTC. Okay, so now we're going to move forward. I know you guys know a lot of stuff. Thought it was just really important to kind of recap and make sure we're all talking about the same thing. So we're going to spend a little time understanding a little bit more about how we're actually calculating APTC or PTC here. For those of you who are not math people, hang with me. I think hopefully it makes sense, but it's really important to understand, and we'll go through that at the end, how you can apply this. So first thing we have to do, of course, is determine their household income and tax household size. Again, that is incredibly important because that says how much their federal poverty level is, which determines what portion of their premiums they should be paying. Then second lowest cost silver premiums, that's what APTC is based off of. So we look at all the plans that individual is eligible for, and we look at the premiums for the second lowest cost silver plan in those, and that's where the APTC is based off of. They can buy other plans, but that's what the premium APTC is based off of. Then we figure out what their net premium is, and we'll go through how we do that a little bit. And then once we know their net premium and the total second lowest cost silver premium, we now figure out the difference is how much APTC we need to get to the full premium. So let's go to the next slide. So I have an example here. In our example, we're going to follow those same 4 steps that I've outlined. And we're going to take a household that makes $60,000 a year. It's a household of 5. And I've done, if you know your FPL tables perfectly, I'm doing a slight bit of rounding, but pretty close. So our household is this household size, tax household of 5, making $60,000 a year. That's about 200% of the federal poverty level. So now figure out our second lowest cost silver plan. What's important to remember is that's only based on who's actually enrolling. So in my example, I'm only going to have 2 of the 5 are actually enrolling. Let's say it's the 2 parents need coverage, the 3 other kids are enrolled in CHIP maybe. And so we figure out what the premiums are for those 2 people who are enrolling to enroll in the second lowest cost silver plan. So from that, I've got about $1,100 a month for their second lowest cost silver plan. So now we have to figure out, based on their income levels, that federal poverty level, what percentage of their income does the IRS say they need to pay, and that becomes basically their net premium. So 200% of FPL means that people have to pay about 2% of their household income. So we take their income, $60,000 times 2%. Their net premium needs to be $1,200 a year. And then we take their annual premiums minus that $1,200, and that fills in the gap. That's our APTC. So in this example, they're eligible for $12,000 of APTC for the year, which for across all 12 months is $1,000 a month. Okay. Second example, let's take one with a little bit higher income. So higher income, we should expect to see the APTC be smaller. So same household makeup, I'm not going to change that on you. So still looking at a household of 5, tax household of 5 with 2 enrolling. And but now we have a higher income of $84,000 a year. That puts them at 275% of the federal poverty level. If you look at row 3, that means that they're actually supposed to pay 5% of their household income. So that took the net premium up to $4,200 a year. And because that net premium is higher, but the total second lowest cost silver is the same, we now have less APTC. So we take that total second lowest cost silver and subtract out the net premium. And now we have $9,000 a year for annual APTC, or across the full 12 months at $750 a month. So we had in our first example, $60,000 a year income, and they were getting $1,000 a month of APTC. And now we increased the income to $84,000 in the second example, and their APTC went down to $750 a month. Okay. So we don't need you to be able to do those calculations, but that's basic calculation of what APTC is doing. And so you can understand why certain changes and have an impact on someone's APTC. Now, what we really wanted to focus on today is why this. So we've talked about what that looks like to do your APTC calculations. what happens now if you make a change in the middle of the year? So remember back to the beginning of this, we talked about your premium tax credit on your federal tax return looks at your annual household income and figures out what your tax credit should be based off of that. It's always, so when we're doing APTC, we always need to be looking at ultimately the annual amount of tax credit that a person's going to get, because that's what ultimately happens on their federal tax return. So when people change their income in the middle of the year, they're changing their annual income, but we're already part of the way through the year, which means it gets a little more complicated. We can't just do the relatively simple math that we did on the previous 2 slides, because we can end up with customers then getting too much and too little. So I want to look at an example of someone making a mid-year change. This is our 3rd example. So Scott, go to the next slide. So we're going to take someone who started the year off in January, enrolled with that $60,000 of household income that we talked about in the first example. So from that original calculation, we know that with $60,000 of income, they should be getting $12,000 a year of APTC, or $1,000 a month. So that's how they start the year off in January. And then in July, they're going to come in and say, oh, their situation's changed. Their income has actually gone up to $84,000. So let's look at a simple way, we're calling it method A, for how we would, handle that mid-year change. So one more, Scott. So here they are starting at the year in January, making $60,000 for across the whole year. So that's at the bottom of the year, and is $60,000 of income. And based on that, we gave them $1,000 of APTC per month. So they got through the first 6 months, and with a total of 6,000 used so far. But now, next slide, Scott. Now they've changed their income to $84,000 in July. So that doesn't change anything that's happened for those first 6 months. For the first 6 months, they got $1,000 each month for $6,000 so far. But now their income has changed. So if we were to, stop right there, Scott. If we were to then just say, let's apply that $750 a month, because we know if someone makes $84,000 a year, we did the math already, apply $750 a month, we now get a total for the year of $10,500. And next, Scott. Problem with that is that's too much. They now have received more than their $9,000 in the year that they should get. And the reason was not because the math is wrong that we did in for example 2, the math there was right, saying if someone makes $84,000 a year, they should get $9,000 of APTC for the year. The problem that the $750 a month is based assuming they were enrolled for all 12 months at that income. So we can't use our simple calculations that we did in examples 1 and 2 and apply those just simply to a mid-year change, because this is the risk that we have. The risk is that you're going to give someone too much APTC, and now this person would owe back $1,500 on their tax return. So what we've done is, go ahead to the next slide here. So what we've done is we actually, when we're dealing with mid-year changes, and we're only going to talk about income changes, but other changes would apply here, we actually add another step to the way we calculate APTC. So we have those same first 4 steps that we did before. And in fact, I think this is off of $84,000. So those first 4 steps are all the same. Someone makes $84,000, gets all the way down to step 4. Yes, that annual amount of APTC they get is $9,000. That's correct for the year. But before we can figure out how much they get per month, we need to take into account how much APTC they've already used for the year, so we can figure out how much APTC is left for them to use, and then figure out a monthly amount. So we know that so far they were using $1,000 a month for 6 months. So they've already used $6,000 of APTC. So to figure out how much is left over for them still to use in the year, we take their annual amount of APTC, which is $9,000, subtract out the $6,000 they've already used, and that leaves us with $3,000 of APTC left that they can use for the year. We then divide that by the number of months that are left over, and now we're finding that they're eligible for $500 a month of APTC. So let's look at, fill out that monthly chart again. So let's go to the next slide. Same layout, but let's do this different calculation where we are sort of taking into account how much was already used. I'm calling it method B, for lack of a better term. So first, next slide. So again, we're starting off with, originally they were making $60,000 a year, and they've taken $1,000 for each of those first 6 months. Now, next, we report that their income's changing to $84,000 in July. Next one's cut. And instead of applying that $750 a month, like we would have did in our first example, we now figured out that by taking into account how much they've already used, it actually should be $500 a month. So next. And voila, the math actually adds up that by the end of this year, they have now received $9,000 of APTC, which based on their annual income is the right annual amount of APTC to receive. So why does this matter? And I know a lot of people don't like math, and I acknowledge I do like math, but thought it was really important to show you all this so that, because assisters and brokers are a really important resource for our customers to understand everything around their coverage, but in particular, these really complicated things like tax credits and understanding how to estimate your income and the risks associated with the, if you make it too low or too high, and understanding why that works. So it is important that you guys understand what's actually happening underneath the hood. But it's also important because you need to understand how to appropriately use Penny in different situations. So let's talk about the two kind of key ways that you get APTC calculations. You can either do the entire long customer application, or you can use browse for plans. Those are two different ways that Penny lets you can use Penny to calculate and make an APTC calculation. And we see a lot of, and I understand why, browser plans is a lot faster and a lot simpler and easier to, quick to get an answer on. But it has key limitations. And so I want to talk about why it is important when you absolutely need to use the customer application to get a calculation of APTC. Because first is, the application is truly the only way you get an accurate APTC eligibility determination. I know the application is long, but it's long for a reason. There are a lot of different criteria that come into play and impact a household's eligibility. And that's why we have all those questions. We're actually not allowed to even ask more questions than we need to be able to determine eligibility correctly. So all of those questions have a purpose, and if you don't answer if you kind of try to take a shortcut around that, you can miss things that would have an impact on someone's eligibility. So that's one thing to remember with the application. Second is what we just talked about. Any of these mid-year changes, like the income changes we talked about, you have to use that application, because only through the application are you going to get calculations that take into account the customer's activity that they've had throughout the year. And as we showed in those two different ways we calculated mid-year income change, it makes a difference. It makes a noticeable difference sometimes, depending on what the change is. And so if you are trying to do a kind of simplified approach, like in example 1 and example 2, you're not going to necessarily, you are going to get a different answer than if you use the application to report those mid-year changes. Third thing that we've seen go wrong sometimes is, even if you have accounted for all the eligibility criteria and maybe you're not even making a mid-year change, If you make an estimate using Browse for Plans today, but then you don't enroll someone until July 2nd, you now have different effective dates because the eligibility calculations are based on effective dates of first of the month following whenever you're doing the application. So not only would you have different coverage start dates, that does mean also a different number of months that they're going to be covered. There can be different age rates. If someone had a birthday between today and July 2nd, now you have different age rates as well. So that's an area that we've seen, can be, even in a really simplified version, you can get up with different results because you're not accounting for the effective date when you're actually doing the application, when you were doing your initial estimate with Browse for Plans or something. So those are all the reasons why it is worth, and you should really be using the customer application when you are talking to a customer about calculating APTC. That doesn't mean that there's not really some scenarios where using the Browse for Plans or sometimes called anonymous shopping, can be really useful. So if you have a customer who has never had any activity in Penny, at least not in the current plan year, and you've covered sort of all of the eligibility criteria, they have a really simple scenario, then yeah, Browse for Plans is going to get you a pretty accurate result. The other scenario that is where Browse for Plans is going to be pretty accurate and really good to use there is if you are doing plan shopping for a current Penny customer who maybe has a life event, but whatever their change is, and wants to change plans or look at other plan options, but they're not changing something that would impact their eligibility. So things that would impact their eligibility could include a change in income, a change in the number of people seeking coverage. Those will all have an impact on APTC because those were all criteria that we used in our 4 or 5 step calculations earlier. So just remember those things. If you are using Browse for Plans, there are a lot of ways that you can easily get a result that is different than when you're doing an application. And so it is worth, your application should be really your go-to place, or with only certain exceptions for the Browse for Plans. I also want to call out that you should really be very cautious if we do know that some assisters and brokers are using other tools outside of Penny to estimate, to either do their own APTC calculations, to provide estimates of APTC, and just wanted you guys to understand how we are calculating it and what some of those complexities are that we take into account, because there are reasons that you may get a different result than when you apply for Penny, and it often is that you're not taking into account all of these different criteria that we are taking into account when someone does their application. So please be really, really careful if you are using these other tools, so that, because you get different results, but it's because they are not accounting for all of the eligibility criteria, changes, previous activity in the customer's account, etc. And so that can cause confusion, and we want to make sure that we can avoid that at all costs. So next slide. I think if we want to go ahead, and I know there's been some questions coming in too on a variety of topics. So we do have a few minutes, Scott, if we want to hop to questions.
All right, fantastic, Hannah. Thank you again so very much for providing us with those updates and overviews. Julian, if there are questions, please feel free to call them out. Just as a reminder to the group, again, any questions that are submitted in the chat that we were unable to address during the time that we have this afternoon, please know that we will download those questions, address them, and post them as a Q&A resource on the Penny Community Workgroup meeting webpage. Julian, are there any questions that you'd like to address?
Yeah, I think we have a good one here. So the question was, if a client changes their income drastically midway through the year, kind of like in the example we showed, would they be able to shop again if the new cost is too high?
So that's a great question. Reporting income changes doesn't automatically create a special enrollment period. So in order to make a change in plans, you need to actually, the customer has to experience a qualifying life event change. And a change in income in of itself is not necessarily a qualifying life event. There are a couple of qualifying life events that are income based, but you need to be very careful on those. That I don't have the exact language in front of me, but so there's a life event that where you have a change in your income results in a change in your eligibility for financial assistance. That doesn't just mean that, okay, now I'm eligible for a few dollars more, a few dollars less of APTC. That means someone went from being not eligible at all for financial assistance to now being eligible for financial assistance. That is a qualifying life event. But your APTC changing by $50 or even $500 is not in of itself a life event. So the only way to make a plan change is to actually experience a qualifying life event. There is a special enrollment period quick reference guide in the broker sister sections on the Penny agency site. We do update that each year, and that's a really good guide. So you will see not only all of the life events, but also some notes, including like on some of those that can be a little bit confusing, like these financial ones, what is and what isn't going to qualify under those. And if you have any questions, you can call, Penny customer service. But in general, the income change does not create a life event to make a spec change, plan change.
All right, thank you, Hannah. And Julian, were there any other questions?
Yeah, I think we got time for one more here.
Okay, sure. Yep.
So another one was when modifying income mid-year, I found the premiums are increased if a birthday took place prior, or if a birthday took place, and that the accumulators restart when income is below 250% of FPL.
So I think I know where this question is getting at. If your income changes mid-year and that change results in a change in your eligibility for cost sharing reductions, so maybe you went from making more than 250% of the federal poverty level to below 250% of the federal poverty level, that is a scenario where you actually will see. So sorry to back up. Let's say you're making that change and you're enrolled in a silver plan already. So you're currently enrolled in just a regular silver plan. Your eligibility, then your income drops below 250% of FPL. We will actually change your enrollment from that regular silver plan to the cost sharing reduction version of that silver plan that you're eligible for. If you were enrolled in a gold plan and your income changes to dropping below 250% of FPL, you would be newly eligible for cost sharing reductions, but we wouldn't change that plan automatically because you're in a gold plan. We can't automatically change you into a silver cost share reduction version of a gold plan because those don't exist. But so yes, there will be a plan change automatically if you're enrolled in silver plan and your income changes in a way that changes your eligibility for a cost sharing reduction plan.
All right. Well, thank you again, Hannah, Julian, Chachi, and everyone here at Penny for joining us for today's meeting with our community partners. I'd just like to remind everyone that if if you have questions as a broker, a sister, you can always reach out to 844-844-8040, Monday through Friday, 8 a.m. to 6 p.m. Or you can email us at brokers@penny.com or sisters@penny.com. Thank you again so much, everyone, for the privilege of your time. We appreciate this more than you know, and we also welcome your continued feedback and engagement with Penny. We could not do what we do without you. So please, know that you are vital to our success and to helping protect Pennsylvanians. So with that being said, thank you so much, and I hope you have a peaceful day. Thank you.